Welcome to today's video where we'll be exploring ischemic nephropathy, a serious condition affecting the kidneys. We'll delve into what causes it, how it develops, its symptoms, and the latest advancements in diagnosis and treatment. Join us as we unravel the complexities of this disease and understand how to protect kidney health. Ischemic nephropathy arises from insufficient blood supply to the kidneys. The primary culprit is often atherosclerosis, a hardening and narrowing of the renal arteries due to plaque buildup. This process, fueled by factors like high cholesterol, high blood pressure, smoking, and diabetes, restricts blood flow, depriving the kidney tissue of vital oxygen and nutrients. Less common causes include renal artery stenosis due to fibromuscular dysplasia, renal artery aneurysm, or even external compression of the renal artery. The lack of blood flow initiates a cascade of detrimental effects within the kidneys. When oxygen and nutrient delivery is compromised, kidney cells, particularly in the tubules and glomeruli, become damaged and can eventually die. This cell death triggers inflammation and scarring, a process called fibrosis, which further impairs kidney function. As more and more kidney tissue is affected, the kidneys progressively lose their ability to filter waste products and regulate fluid balance, leading to chronic kidney disease. Ischemic nephropathy predominantly affects older adults, particularly those with pre-existing cardiovascular disease, diabetes, or hypertension. The prevalence increases with age as atherosclerosis becomes more common. Studies suggest that it's an underdiagnosed cause of chronic kidney disease, especially in populations with significant risk factors for vascular disease. While specific global statistics are challenging to obtain, the incidence is rising in parallel with the increasing prevalence of diabetes and cardiovascular disease worldwide. In the early stages, ischemic nephropathy may not cause noticeable symptoms. However, as kidney function deteriorates, various signs and symptoms may appear. These can include uncontrolled high blood pressure, which often resists standard treatment. Patients may also experience fatigue, swelling in the ankles and feet, shortness of breath, changes in urination patterns, such as increased frequency or decreased volume, and even nausea and loss of appetite. In severe cases, symptoms of kidney failure can develop. Diagnosis of ischemic nephropathy often involves a combination of clinical evaluation, laboratory tests, and imaging studies. Doctors will assess the patient's medical history and conduct a physical examination. Blood tests, including serum creatinine and blood urea nitrogen (SBUN), are used to assess kidney function. Urinalysis can detect protein or blood in the urine. The gold standard for diagnosis is renal angiography, which uses dye and X-rays to visualize the renal arteries and identify any blockages or narrowing. Less invasive options include Doppler ultrasound and CT angiography, which can also provide images of the renal arteries. Ischemic nephropathy can be broadly categorized based on the severity and extent of renal artery stenosis. Single kidney ischemic nephropathy refers to the disease being limited to one kidney, while bilateral ischemic nephropathy involves both kidneys. Another classification is based on whether the cause is atherosclerotic renal artery stenosis or other conditions such as fibromuscular dysplasia. The severity of kidney damage is also used in classification schemes of chronic kidney disease like the DIGO kidney disease, improving global outcomes guidelines. Treatment and management aim to improve blood flow to the kidneys, control blood pressure, and slow the progression of kidney disease. Lifestyle modifications such as a healthy diet, regular exercise, and smoking cessation are essential. Medications to control blood pressure, cholesterol, and diabetes are crucial. In some cases, revascularization procedures like angioplasty and stenting may be necessary to open up blocked renal arteries. These procedures involve inserting a catheter with a balloon to widen the narrowed artery and placing a stent to keep it open. End-stage renal disease necessitates dialysis or kidney transplantation. Preventing ischemic nephropathy focuses on managing risk factors for atherosclerosis. This includes adopting a healthy diet low in saturated and trans fats, cholesterol, and sodium. Regular exercise, maintaining a healthy weight, and avoiding smoking are also vital. Controlling blood pressure, cholesterol, and blood sugar levels through medication and lifestyle changes can significantly reduce the risk of developing ischemic nephropathy. Regular check-ups with a healthcare provider are essential, especially for individuals with risk factors. The prognosis for ischemic nephropathy varies depending on the severity of kidney damage, the presence of other health conditions, and the effectiveness of treatment. Early diagnosis and management can help slow the progression of kidney disease and improve outcomes. However, if left untreated, it can lead to end-stage renal disease requiring dialysis or transplantation. Current research is focused on developing new therapies to protect kidney cells from damage caused by ischemia and fibrosis. Novel approaches include exploring the use of stem cells and gene therapy to regenerate damaged kidney tissue and prevent the progression of chronic kidney disease. Further research is needed to refine these techniques and assess their long-term efficacy.